Hello and welcome to Medical Dialogues. I am Dr. Bhumika. Here is what I bring to you from the world of medicine. What would happen if tobacco smoking is eliminated? A Lancet Public Health study finds. Accelerating the decline in tobacco smoking globally by decreasing smoking prevalence from current levels to 5% everywhere could increase life expectancy and prevent millions of premature deaths by 2050, according to a study from the Global Burden of Disease, Injuries and Risk Factors. Tobacco Forecasting Collaborators published in the Lancet Public Health journal. The analysis suggests speeding up progress towards ending smoking could deliver substantial population health benefits over the next 3 decades. Findings from the study suggest that based on current trends, global life expectancy will likely rise to 78.3 years by 2050, up from 73.6 years in 2022. However, if tobacco smoking were to gradually decline from current levels to a rate of 5% in 2050, this would result in 1 year of additional life expectancy in males and 0.2 years in females. In a scenario where tobacco smoking was eliminated from 2023 onwards, this could result in up to 1.5 additional years of life expectancy among males and 0.4 years among females in 2050. In both scenarios, millions of premature deaths would also be avoided. We must not lose momentum in efforts to reduce and ultimately eliminate smoking around the world. Our findings highlight that millions of premature deaths could be avoided by bringing an end to smoking, said senior author Professor Steen Emil Lancet of the Institute for Health Metrics and Evaluation. The authors produced estimates using IHME's Future Health Scenarios platform, which uses data from the Global Burden of Disease, Injuries and Risk Factors study. The new analysis provides in-depth forecast of the health burden for 204 countries, broken down by age and sex from 2022 until 2050. It is the first study to comprehensively forecast the health impacts due to smoking for all countries and all causes, as well as on 365 diseases and injuries. The main measure studied was years of lost lives, a measure of premature deaths, counting each death by the remaining life expectancy at the age of death. For example, if the ideal life expectancy is 91 years and someone dies at the age of 50, that would result in 41 years of lost lives. This is because they lost 41 years that they could have potentially lived. Life expectancy at birth and years of lost lives were evaluated under 3 future scenarios, as well as modeling a most likely future scenario based on current trends. The authors estimated the impact of 2 alternative scenarios. One assumed countries steadily reduce smoking levels among their population to 5%. The other modeled future health impacts had smoking been eliminated globally in 2023. Taking the difference between the reference and the tobacco smoking elimination as of 2023 scenario allowed the researchers to measure the total future health burden that could be theoretically avoided with intervention. The platform enabled researchers to forecast unique populations for each scenario, allowing them to account for changing population dynamics across the scenarios. Between 1990 and 2022, age standardized smoking rates among males aged 10 years and older fell from 40.8% to 28.5%. In the same period, smoking in females aged 10 years and older declined from 9.94% to 5.96%. Based on current trends, the estimates indicate smoking rates will continue to decline, albeit at a slower pace than over the past 3 decades. In 2050, it is estimated that after adjusting for age, 21.1% of males and 4.1% of females will smoke, with considerable regional variation. For males ranging from 3.18 in Brazil to 63.2 in Micronesia, and for females ranging from 0.5% in Nigeria to 38.5% in Serbia. However, the findings indicate that accelerating efforts to eliminate smoking could result in fewer premature deaths. In the scenario in which countries reduce smoking rates to 5% by 2050, there would be 876 million fewer years of lost lives compared to the most likely future scenario. Life expectancy in 2070 would be 77.1 years in males and 80.8 years in females. The greatest gains in life expectancy among males would be in East Asia, Central Asia and Southeast Asia, with between 1.2 and 1.8 extra years of life gained. Among females, life expectancy would increase the most in East Asia, high-income North America and Oceania, with between 0.3 and 0.5 additional years gained. For the scenario in which smoking ended globally in 2023, the estimates indicate a maximum of 2.04 billion years of lost lives could be avoided by 2050 compared to the most likely future scenario, and life expectancy in 2050 would be higher still at 77.6 years for male and 81 years for female. Thank you for watching Medical Dialogues. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe and press the bell icon.